In this instructional video, we will demonstrate how to perform the proper technique of the extra intraoral examination. Observe the patient upon reception. The visual examination, you're going to check the extraoral tissues. These include the forehead, the eyes, cheek, nose, lips, and neck. For the palpation examination, the clinician will don examination gloves. Bilateral palpation of the submental area, submandibular area, preauricular nodes, postauricular nodes, occipital nodes. The anterior and posterior chain of the cervical lymph nodes along the sternocleidomastoid muscle, right side and left side. Lastly, the nodes of the neck, the supraclavicular nodes, the clavicle area to the shoulders. You will palpate the thyroid gland. Ask the patient to swallow. A bilateral palpation of the TMJ. Ask the patient to open and close. The parotid gland, have the patient clench. Now you will wash or sanitize your hands and apply new gloves. Visual examination, observe the labial mucosa, upper lip and lower lip. The buccal mucosa, right side and left side. The palate, hard and soft. The posterior pharynx, patient says ah. Ah. The tongue and floor of the mouth. Palpation examination, the labial tissues, upper and lower lip, retract with your index finger and thumb. The buccal mucosa, bimanually the index finger and the middle finger of the opposite hand, right side and left side. For the palate, use your index finger to palpate the hard and soft palate. A piece of gauze for the tongue. The clinician will use the gauze to grasp the tongue, checking the lateral borders, the dorsum and ventral surfaces, also palpating the posterior and the middle third. The floor of the mouth, the clinician will instruct the patient to raise the tongue as they palpate from posterior to anterior on both sides. This concludes the extraoral and intraoral examination.